Arthritis and joint pain are the leading causes of disability. In today's show, we're going to talk about the changing landscape when it comes to managing arthritis, looking at it from a metabolic perspective. So it's been long recognized that osteoarthritis specifically, which is a subset of arthritis, is common wear and tear. You overuse your joints over time, so your hips, your elbows, your knees, your low back, and your shoulder start to break down from wear and tear, the old thinking goes. But the new science is suggesting that this disease, osteoarthritis specifically, has a lot of metabolic origins. And in today's show, we're going to talk about some of the research validating this new concept. And it turns out that exercise, walking, supporting metabolic health with a low-carb diet, for example, are some of the best ways to support the health of your joints. So one of the papers we're going to talk about today is titled Biomarkers for Osteoarthritis, Current Status and Future Updates, that was published in Best Practice and Research Clinical Rheumatology. So as I mentioned, the landscape of arthritic treatment is changing. The investigators say for many years, osteoarthritis was described as a non-inflammatory wear and tear disease because it was perceived to be a slow-burning disease that typically develops over a long period of time due to the natural wear and tear in synovial joints. However, this wear and tear model falls short of describing all inflammatory disease mechanisms, and thus the description is no longer used since it prevented the field from moving towards more innovative treatment options. The wear and tear disease concept is also antagonistic to data emerging from recent advances in our understanding of the crucially important role of inflammation, represented by complement cascades, innate and adaptive immunity, as well as firmly established concepts of chronic low-grade inflammation progressing osteoarthritis. Now, for more details on this, please check out the full-length podcast with Dr. Amy West. She's a physiatrist out of Harvard. Really excellent discussion all about metabolic health as it is related to joint health. But I think it's important to understand because many people have joint pain, and so that is the reason why they are not exercising and regularly engaging in walking between 8 and 12,000 steps per day, which, by the way, it was Nature Medicine, I believe, in 2021 showed that if you can walk between 8 and 12,000 steps per day, your risk of arthritis, low back, and joint pain goes down. So if you have arthritic joint pain, if you have chronic knee pain or hip pain, you should be actually exercising more because it turns out that exercise releases exerkines and myokines, which exert anti-inflammatory signaling properties within your joint tissues and throughout the body. So I want to continue to talk about osteoarthritis, but first I want to let you know about an awesome footwear that I use all the time. And in my opinion, the best minimalist barefoot shoe on the market, Vivo Barefoot. I got into these shoes about 3 years ago. The first time I wore them was on a pretty extensive backpacking trip, which I do all the time in the summer months. But what I found very unique after such a large trip was about 22 miles over the course of 2 days, is my legs were sore in areas that I've never felt before because I was using different parts of my foot and my gait was so much different because I had minimalist footwear on. And it was really important, friends, because I've noticed changes in my low back pain, in my gait, and in my ability to exercise at an intense level for a prolonged period of time. I've put over 1,200 miles in these boots in the backcountry carrying my daughter's food, our sleeping bags, our shelters, all of that. So friends, you can save 20% by going to vivobarefoot.com and use the code HIH to save at checkout. What's also unique about Vivo Barefoot is they offer a 100-day trial. You can try the shoes, see if they work for you, and if they do not, there's a 100-day, no-hassle, full refund guarantee. So going back to osteoarthritis, and let's finish up connecting the dots here between joint pain, joint degeneration, and metabolic issues. So I'm going to share with you figure 3 here, which highlights the immune cell activity, the degradation of cartilage, and the degradation of bone, as well as connective tissue. You can see here multiple chronic inflammatory immune cell mediators are involved in the breakdown and the degeneration of joints. So it turns out that our metabolic health is intimately connected to the health of our joints. So if you're overweight and you have knee pain, hip pain, low back pain, or any sort of arthritic pain, and as Amy talks about in that wonderful interview, even trigger finger, this is a sign that you should start to prioritize metabolic health. And we'll talk about how to do that shortly. But we also need to first recognize that body weight and body weight loss is independently associated with poor joint function and joint pain. Numerous studies have talked about this. I'll just share with you a few of them on the screen. I'm not going to go into extensive detail. But numerous studies show that the more overweight you are, the more painful your joints are, and the more commonly people that go in for orthopedic issues and osteoarthritic pain, there's a strong correlation with increased body mass and body fatness. So there's a correlation here with leptin. It turns out that leptin is what's known as a pleiotropic adipocytokine, meaning it's an adipokine that is released from fat tissue that triggers chronic inflammatory cascades in the body. Many people think that leptin is just involved in appetite regulation and satiety. It turns out that leptin is also a cytokine, just like interleukin-6 or TNF-alpha or interferon gamma. Leptin stimulates chronic inflammatory pathways in the body. So the more body fat you have, the higher levels of leptin you will have, and the more chronic inflammatory joint pain you will ensue as a result of that. Numerous studies going back to as early as 2013. I've been following this leptin research for the better part of 10 years now. Research finds that when people who have osteoarthritis of their hands as well as their lower extremity joints, when they lose weight, the joint pain in their hands gets ameliorated. Now, why might that be? They're not walking on their hands. They're not doing handstand walks or this. Why would the joint pain in their hands, if it was just simply wear and tear, go away? Well, it's because of the fact that as they reduce their body fatness and improve their body composition and increase the amount of lean muscle mass they have to the amount of fat mass they have, they are experiencing a reduction in the chronic inflammatory signatures in the body, and therefore their joint pain tends to resolve over time and become less painful. And part of this is mediated by leptin. And so you can test your leptin levels. This is not generally something I recommend all the time. You definitely want to test it first thing in the morning, just like when you would test testosterone, because leptin oscillates in a diurnal rhythm. But high levels of leptin over 20, I think it's nanograms per ml, are correlated with increased hyperperception to pain and joint issues. So that's something that you can look at, and we often see people experiencing an alleviation of joint pain, especially in their hands and upper body extremities when they lose weight. And so that kind of goes against this wear and tear arthritic model, because why would there be so much wear and tear in the hands if you're relatively sedentary and not doing handstand walks and so forth? So I think that's important to acknowledge. Now, how do we improve our body composition? We've talked about this many, many times, my friends. First thing is walking after meals. And so we're talking about 10 to 15 minute walks after meals is a phenomenal way to help support your metabolic health and reduce the post-meal surges in glucose as well as insulin. And it turns out that glucose and insulin parallel with leptin levels. Hyperinsulinemia, high levels of insulin, are linked with hyperleptinemia. So we want to start walking after meals. We want to balance our carbohydrate intake and match it and have it be commensurate with our exercise volume. So if you're not very active, you don't need a lot of carbohydrates. I know that these old school dietitians say, well, glucose is a primary fuel for your brain. Yeah, that might be true, but your body is really good at fueling your brain with fatty acid derivatives known as ketones, beta-hydroxybutyrate, and beyond. So if you're not an endurance athlete or you don't exercise a lot, you really do not need more than 50 or 75 grams of carbs per day, my friends. Your brain is going to be just fine. If you eat a low-carb diet, numerous studies actually show that you can improve your cognitive performance if you are struggling with some sort of cognitive issues. There's multiple studies finding that people with mild cognitive impairment benefit from going on a low-carb diet because it's like an energetic backdoor. Ketones are, that is, in a insulin-resistant brain. So a lower carb diet, walking after meals, resistance training 3 to 4 days per week, trying to hit every major muscle group at least once per week. This can be body weight, this can be push-ups, this can be squats, deadlifts, hip hinges, pull-ups, all these things that we've talked about in various videos that I will link in the description below if you want a course on that with Erica Grisanti, one of the most sought-after trainers in Los Angeles. Last but not least, compressing your feeding window. Numerous studies find that people who just do early time-restricted feeding or time-restricted feeding in general, like eating between the hours of 10 and 6 p.m. or 12 and 7, do much better in terms of balancing the peaks and troughs in their blood glucose levels. So starting to embark on a time-restricted feeding program is a great way to support your metabolic health. And if you pair all of these things together, you can expect to improve your body composition. And again, just to reiterate, body composition is intimately connected to joint pain and hyperperception to pain and less degeneration of the joint. So we know that people who have low levels of muscle mass and high amounts of body fat have higher levels of pain, perceived pain, as well as degeneration of the joint. And just being inactive, I don't know about you, but if anytime I go on a road trip that's longer than a day, my knees and my hips start to hurt. So being inactive is a harbinger for more joint pain. So just, as I mentioned, getting on some Vivo Barefoots, going out and going for a walk and just staying active is going to help improve your joint pain. So in conclusion, it's really antithetical to science to continue to blame arthritis on wear and tear. Could some of joint pain be from wear and tear and injuries? Like if you were a ski racer and you did a lot of moguls or something, or you had an acute injury where your meniscus is torn? Absolutely. But by and large, since a super majority of people now are overweight or obese and or have metabolic disease, most of the joint pain that people are suffering from has a metabolic origin or a body composition origin. So we should be addressing joint pain and joint issues and joint dysfunction from that vantage point. It's a new set of heuristics that even rheumatologists are now recognizing that we should focus on, my friends. So I very much appreciate you tuning all the way into this video. Thank you for hitting that like button. Let me know what you think of the science in the comment section below, and we'll catch you on a future video.